Hi everyone, I'm Dr. Joanna McPherson and this is Rusty. Rusty's going to help demonstrate the importance of oral exams as well as how to perform one. Now when you take your pet to the veterinarians, you'll notice that we do an oral exam as part of our larger physical exam. And despite how brief it might seem, there's a lot to learn from one of our oral exams, and let me walk you through. So first and foremost, one of the things we're going to be paying attention to is the color of the gums. So you should notice that the gums are a healthy pink color, and sometimes they can be pigmented, just like in Rusty's case here. Gums should be a healthy pink, and they should be moist. They shouldn't be sticky or dry. Colors like yellow, white, blue can all be a sign of an underlying medical condition. In addition to the color, you may or may not have noticed your veterinarian touching the gums, or your veterinary technician touching the gums like so. What we're looking for is something called capillary refill time. So how long it takes for that blood goes white to pink. Capillary refill time should last less than 2 seconds. And again, it's a way to tell if there's an underlying circulatory disorder, such as heart disease or another illness afflicting your pet. In addition to color and mucous membranes and gum color, of course, what you can find in the mouth, plenty of teeth. So unfortunately, by the age of 3 years, about 80% of dogs and cats do have some sort of dental disease. Now, when your vet checks your pet's mouth, not only are they looking at the teeth for tartar, plaque, they're looking at the gum line for signs of gingivitis or inflammation of the gums. We're also looking for any fractures or mobile teeth. Now, if your dog eats any hard bones, they can be at risk for fracturing, especially this back tooth here, and that's called a slab fracture, which can be very painful and does need to be addressed medically. We're also looking at the tissues for any masses, lumps, or bumps that don't belong, ulcers. We may or may not open and have a look at the palate and the tongue, looking for anything else that doesn't belong. I hope you enjoyed our video and hope you learned something new. Thanks for stopping in.